In honor of 20K followers, thank you all. Let's talk about something that if you're an ICU nurse, you know like the back of your hand. If you're going into the ICU, you need to know this like the back of your hand. And if you've had a loved one in the ICU, you've probably heard some staff talk about this. And that is the Glasgow Coma Scale, often called just GCS. The GCS is the most common scoring system to determine a patient's level of consciousness after a traumatic brain injury, or after, a serious infection. Really anything that can mess with the patient neurologically, we use the GCS to determine kind of where they're at. It's divided into 3 parts: eye-opening, motor response, and vocalization. First, with eye-opening, you can be scored on a scale of 1 to 4. 4 means the patient is opening their eyes spontaneously, just kind of looking around, doing their own thing. 3 would be they open their eyes to vocalization. So let's say the patient's name is Tom. Hey, Tom. When you say their name, their eyes will open. That's a 3. A 2 would be to pain. So I know a lot of non-healthcare people will see the nurse or the doctor kind of pinch their loved one and be like, "What? Why are you doing that?" We're checking for a few things, but in this case right now, eye opening. Do they open their eyes to pain? Yes or no? That would be a 2. And if they don't open their eyes to any of those things, it would be a 1. Next, vocalization. A lot of our patients in the ICU are intubated or on life support. So usually this is a 1 for no vocalization, but a 5 would be they're talking, they're completely alert and oriented. A 4 would be they're talking, but they're just really confused. They don't know what the hell is going on. For example, my patient today was like, "Passing my cigarettes, I need a damn cigarette." Sir, you have not had a whole cigarette since you've been here. Whatever. A 3 for the verbalization would be they're talking, but it doesn't make sense. It's garbled, or the words it's. A 2 would be the patient is making a sound, but they're not necessarily talking. No words. And then a 1 would be the patient is not talking, or like I said, the patient's intubated, so they can't talk. And lastly, we have the motor response. This is on a scale of 1 to 6. So a 6 would be the patient is completely following commands in all extremities. I'm asking them to squeeze my hands. They do. They wiggle their toes, etc., etc. 5 would be localizing. So that's, again, where we would pinch the nail beds to see if the patient would reach over to that spot where they were pinched. That's localizing. Typically, the patient would have to cross the midline in order for it to be considered localizing. 4 and 3 would be flexion. So if I pinch them, do they kind of move away? What do they do? Do they move away? Yes or no? 2 would be extension,